Welcome. You are listening to the Mari Mukonda Show on Salam Media with your host, Mari Mukonda. So, we often hear of kidney stones or bladder stones, and what comes to our mind is the actual stone, a pebble, a rock. We picture that, oh, okay, perhaps a person has that in their system. But is it that? We're going to find out about kidney stones with the urologist Dr. Salim Choonara, who is on the other side. Assalamu alaikum, Dr. Choonara.
Wa alaikum salam wa rahmatullah and salam to your viewers and listeners as well.
Doctor, it's always a pleasure to have you joining us on the show. What are kidney and bladder stones?
Okay, so obviously, as you said, kidney or bladder stone, so that already anatomically defines its location. Kidney meaning in the kidney, bladder obviously in the bladder. It's not an uncommon situation. We do see this quite, I would say, quite commonly. Incidence-wise, probably about maybe 10 to 11% of individuals may be affected by stones. I think the common terminology or the understanding of most individuals is of kidney stones. People understand kidney stones better. The severe pain that you get on your kidney, most cases in the middle of the night when you come through to the emergency department because of excruciating nature of the pain, maybe passing a bit of blood in the urine, etc. Most people understand that. There is an inherent difference with bladder stones. The mechanism is different. Commonly, it can be that a bladder stone can be because it fell from the kidney and it ended up in the bladder. That's how it ended up in the bladder stone. But there are more specific conditions related to the function of the bladder that give rise to bladder stones. Okay, so I thought maybe let's touch on that a little bit. So the common situations in those cases are those medical situations where patients have difficulty urinating, or there's a situation where urine stays behind in the bladder. So they have, more often than not, they've got larger quantities of urine staying behind in the bladder, and they're unable to get it out. And as a result of that urine crystallizes over time and can form a bladder stone. And those conditions generally refer to the function of the bladder, and most commonly the neurological function of the bladder. So those individuals have what we call the neurogenic type of bladders, or there's a damage to the nerve supply of the bladder. It can happen in diabetics as well, where they have very weak nerve function of the bladder. As a result, they're unable to empty the bladders well enough. It can give rise to stones. People with spinal disease, spinal deformity, spinal injuries, patients with spinal bifida, those. So most of the neurological elements, some patients also that have things like multiple sclerosis. So any of the neurological elements that come into play that can somehow interfere with the circuitry of the bladder, the nerve supply of the bladder, that hampers the ability to empty the bladder. If you can summarize it like that, And those conditions are very difficult to treat, because bladder stones, most people are not aware of it because they've got neurological problems, so they can't feel much, It's not, that's why I'm drawing a distinction. It doesn't present the same way like a kidney stone presents. That severe pain makes you go to the doctor. We've seen cases, especially in neurological patients or patients with neurological disease, where the bladder stone can just keep growing and just keeps growing, and it just gets bigger and bigger over time. And I've seen stones maybe up to about close to 10 centimeters in length, And these stones can just get bigger, and patients are not aware of it. They don't have much sensation. It's because of the underlying medical condition. So the distinction about it is one is to be aware of that, One is to sort of, be mindful that situation could arise, because they're not going to present necessarily with pain, which is what makes someone come to the doctor. So that's an important distinction, I think, with just overview of kidney and bladder stones.
All right. So, Doctor, now, what are the signs and symptoms for one? Because you just mentioned that with bladder stones, it's quite difficult for a person to tell, and with kidney stones, they can actually feel a pain. So, what other symptoms can we be aware of?
Okay. So, like I said, with kidney, the telltale sign there is severe flank pain, sort of in the kidney area. And in most cases, people will make a comment about the pain that moves. So it moves from the kidney and tends to go down to the groin. They can feel it. In some men also, they would actually say that the pain feels like it's going into the testicle. That's the level of movement that they would perceive, okay? And another important sign here or symptom there is nausea. Because of the swelling that develops on the kidney, they can develop feelings of nausea, may also vomit as well. But the severe pain that tends to move, sometimes they may see blood in the urine, and also the nausea are generally very sort of telltale signs that we're likely to deal with a kidney stone. Now, when I say kidney stone, remember the kidney is the organ that sits much higher up. The kidney is connected to the bladder by a small little tube called the ureter. Right? Now, just to differentiate this, that's why I say, we use the term kidney stone very loosely, but actually, the one that makes them come to hospital is the stone that goes from the kidney, passes into the tube called the ureter. Once it blocks that tube, the pain is crazy. The stone in the kidney is sort of it's a wider space, it's a bigger cavity. And the stone can float around there, move around there, and it doesn't necessarily give you that excruciating pain that makes you go to the casualty. So, truly speaking, when we speak about a severe pain, it's actually most likely a stone that has gone from the kidney, fallen into that little tube that connects the kidney to the bladder. That's a very tiny tube. The diameter is maybe 5 to 6 millimeters. So, a stone can easily lodge there, obstruct the tube, preventing the urine from passing easily from the kidney to the bladder, causing the kidney to swell, and that drives the pain continuously. So just to anatomically correct that situation. So that's the one that's severe. And like I mentioned, with the bladder stone, it's more subtle. One is to be aware of them, understand the background medical condition, and then you know which individuals are likely to be at risk for bladder stone. So you need to almost identify those patients. Something they will come with pain, or maybe they've gone for a sonar or an X-ray for some other. So sorry, I think we just lost you for a second there. But I think the key here is to understand the kidney pain. I think that's the more common, more typical presentation.
All right, Dr. Salim, please stay on the line. We're going to take a quick break and we'll continue when we return.
Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Kiki's, the taste with a kick. Our revamped exclusive restaurant and takeaway now opened. Kiki's strives to serve you and your family with a wide variety of delicious meals. Enjoy our famous chicken, shish, burgers, pasta, pizza, and many more weekly in-store specials. We offer Friday buffet and Brightbit with a difference. We cater for corporate functions, velimas, and events. Purja facilities provided. Our exciting competition gourmet menu and new menu to be released at our launch. Visit Kiki's at 235 Matthews Mayue Road, Old Stemford Hill Road, Durban. Call 031 209 0119. Kiki's, the taste with a kick.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal's Breakfast Club aim to get a warm, hearty meal to underprivileged children so they can spend the day prospering in their schoolwork. Help feed a needy learner by visiting our website on www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal. Small change, big difference.
Freedom Stationery supply Marlin and Marlin Kids pens to me and my school friends. They supply just about everything we need to help us get a better education, from books to files to rulers. In fact, any accessory we need. Freedom Stationery. Education for the nation. What does accessory mean?
Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Welcome back. You are listening to the Mari Mukonda Show on Salam Media. It is 19 minutes after 11 on this Monday, the 1st of February, 2021. Still on the line is Dr. Salim Choonara, and we are talking about kidney and bladder stones. Dr. Choonara, thank you for staying on the line. Now, who is at risk of getting either kidney or bladder stones?
Yeah, so there's an interesting overlap there. Obviously, brings us to almost like to understand the causes of stones. So, yes, there are certain medical conditions that do predispose individuals to stone formation. There's a common thread between kidney and bladder, and diabetes fits into both those categories. So, diabetics are at risk for kidney stones per se, but diabetics can also develop what we call neurological problem or neuropathy, where the nerve supply especially to the bladder can be impaired, and that can also potentially put them at risk for bladder stones. So that's one of the conditions that can create an overlap between the two. Okay. Other conditions that obviously are other medical conditions, obviously obesity, obviously being ill health, also puts one at risk for stones because of all the metabolic derailing that can result, that can predispose you to developing stones. Individuals that have things like gout as well, because of the high levels of uric acid, they can be predisposed to developing stones. And as I said, most of the other metabolic abnormalities. So remember, whenever we assess somebody with stones, we see them first with the problem, but then we obviously have to then institute a whole lot of investigation to find out what could be the cause of the stone. So sometimes when we see them, we may not have identified any medical condition at the time because we're treating the stone first. But we will then carry out a certain investigative process to help identify that do they have some underlying abnormality that's leading to stone formation. So those would all be all the metabolic abnormalities. Where we look at things like the calcium metabolism, uric acid metabolism, oxalate, how they process in the urine, what's the pH of the urine, is it acidic, is it alkaline? Because the interesting thing about diabetics, and I'm bringing it up because it's common. Like diabetics, we find that the urine tends to be acidic. So even though they don't have a uric acid problem, they don't have gout per se, but they are at risk for forming what we call a uric acid type of stone because of the acidity of the urine. So that's how it predisposes to that. You see what I'm saying? So those are the common ones, such as like diabetes, things like gout, obesity, things like the metabolic syndrome that can predispose one to developing stones. And then there's certain gastrointestinal conditions, like inflammatory bowel disease, also that can predispose one to developing stones. And the reason for that is because of the way the body processes what we call oxalate. Now remember, when we look at the stone, if we were to analyze a stone, it doesn't only have calcium. People always think, oh, it's calcium. Yes, calcium is an important component of the stone. However, there are other components that also make up a stone, such as things like uric acid, oxalate, cysteine. There can be so many other components, and those are where the clues lie as to what could be the underlying cause in that particular individual. So often when we treat somebody with stone, we make a point of trying to get a sample of the stone so we can actually analyze it in the laboratory so we understand the composition of the stone. And knowing that and knowing the background medical condition, we can hopefully formulate understanding of what could be the underlying cause in that individual. And that understanding infers how we're going to treat the patient. So that's kind of the systematic approach that we would follow in an individual with stone,
And what about pregnant women? I came across something that mentioned that pregnant women are also at risk for developing kidney stones.
Yeah, they certainly are at risk for it because obviously during pregnancy is a much more hyperdynamic type of state. Certain individuals are generally at risk for stone formation. What is really interesting though is that we sometimes see conditions in pregnancy which mimic the stone. What I mean by that is that as the pregnancy is developing, okay, what can happen is that the uterus itself can compress on the tube that connects the kidney to the bladder. When it does that, it causes a lot of swelling to develop on the kidney, and the patient can present in a very similar way with stones. How do they come? With very severe pain in the kidney, and it's excruciating pain. So it could mimic a stone, but it's not really a stone. But it mimics a stone because it blocks the tube that drains the urine from the kidney to the bladder. Because of the enlarging uterus, it puts pressure. So sometimes I must be honest with you, my own anecdotal evidence, I haven't seen that commonly stones in pregnancy. We do see, but I would say it's more common to find a situation where, as the pregnancy is progressing, it can be, depending on how the uterus is lying or the position of the uterus is, the compression on the tube that connects the kidney to the bladder is maybe something more common in stones, But we manage in a very similar way because to unblock the kidney. So often you find that sometimes pregnancy, they develop a problem within, they say, in the 3rd month or 4th month. Sometimes we're going to put a tube inside to unblock the kidney, and that tube sort of stay in for the duration of the pregnancy. So when it comes out again after about 6 months or so, So again, one has to be aware of it. If a pregnant woman comes with pain, we'll go through the investigation, find out what it could be. Could it be infection? Could it be a stone? Could it just be a blockage of the kidney? So it follows a systematic approach because people that come with pain, remember, pain can be not only stone, it could be other things. It's in the process of investigating the pain that you come up with a diagnosis. One of them is kidney stone.
All right, so let us talk about the diagnosis. How are they diagnosed?
Okay. So almost probably 95% of stones, 96% of stones can be diagnosed with what we call a CT scan. So in the past we used to use X-rays and ultrasound. We still sort of apply that modality, but that's just to give us an idea what could be happening. It doesn't make a diagnosis of the stone. Nowadays, in our current situation in the 21st century, if we have an individual who is suspecting of stones, we do what they call a non-contrast CT scan. So we don't have to inject any dye into the vein. It's a very basic scan because the scan will pick up any calcium deposits anywhere in the body. So we scan the area from the kidney right down to the bladder. And that, like I said, in 95% of cases, if there's a stone there, the scan will detect it. There's a very small percentage of cases where maybe the scan may not pick it up. But those conditions are very specific. Those are related to individuals that are on certain, specifically antiretroviral medication, where they can also form stones because of the medication that they're using. In that scenario, a scan sometimes may miss the stone. But again, those situations are not the common, and you would be aware of the individual that you're dealing with because of the medication they take you. But by and large, a non-contrast CT scan gives the answer. Simple as that.
The treatment, is there a treatment for it? Is it surgery to remove the stones? Or what does it involve? And also, what can people do at home to avoid getting stones?
Yeah. So if we can think about the treatment in 2 parts, because remember, when the patient initially presents, they come in a very acute state. They're in severe pain. There's a blockage. Maybe let's take a scenario where there's a stone sitting in the tube between the kidney and the bladder. It becomes in very severe pain. Now, there's 2 parts to the situation. One is now that patient is acutely ill at that point in time. We need to deal with the stone first. But what we do is, because of the swelling on the kidney, our intention and our aim is to first unblock the kidney. So you often patients that have been treated for stone, they'll know about something called a stent or a DJ stent. It's like a drainage tube that we place into the kidney that bypasses the stone to unblock the kidney so the kidney can drain free, so the pain goes away. And then often they come back for a second procedure where we then apply either laser or some sort of shockwave mechanism to break up the stone and to remove the stone with some special treatment. So that would be the surgical side of it. However, when an individual comes, we do a scan, as I said to you. Depending on the location of the stone and the size of the stone, in some individuals, we can consider what we call medical expulsive therapy, MET, meaning they can take some tablets, some medication with increase of fluids, maybe soda. We give them a whole cocktail of medication to try and flush out the stone. But that now applies to a small stone most likely under 4 to 5 millimeters. And the stone that has already made its way from the kidney right down to the bladder, it's still in the tube, but it's almost in the bladder. It's probably right at the end of the tube. Those individuals will benefit from medical therapy. But a stone that's bigger than 5 millimeters, that's much higher up in the kidney or in the tube closer to the kidney, for it to make its way all the way down to the bladder is going to be more challenging, So again, as I said to you, the size and the location of the stone will allow us to make a determination whether that individual will benefit from some medical therapy. If that fails, then we go to the surgical therapy. So that's kind of the approach that we would take in a situation like that. In terms of asking about what to take and what to drink, remember, we're going to think about stones as not one cause. There's not one causative factor. Water intake is important. Body habit is important. Diet is a factor. Family history is an important thing. There may be a history of stones in your family. You're genetically predisposed to making a stone. That's a factor to consider. As I said to you, are you obese? Are you overweight? Do you have some underlying medical condition? Are you on any medication? So, it's like almost like a little pot where you put in multiple factors got to come together for these substances to crystallize in the urine. So that's why the approach is on multiple levels. We advise patients on dietary changes. We advise them on water intake. Certain individuals need to be on urine alkaline like citrus soda. If they're diabetic, if they've got some underlying medical condition, we treat that. Then we analyze the stone. If we find some abnormality, then we try to manage that situation. Then we look at we do a whole series of urine tests, 24-hour. We collect the urine over a 24-hour period and see are there any metabolic abnormalities in the urine. And again, based on that, we advise them on certain medication to try to correct some of those abnormalities. So it's a very holistic approach. It's not just one cause of the factor, and neither is it one treatment modality. It's on multiple levels. If I could summarize it for you in that way.
All right. Shukran so much for your time, Dr. Choonara, and for that information. If anybody would like more information from Dr. Choonara, please share your contact details with us.
Okay, so I'm based at the Molpark Hospital, and my contact number is 011-482-2230. That's at the Molpark Hospital.
All right. Shukran so much. Have a wonderful day. Assalamu alaikum.
Thank you so much.
That was Dr. Salim Choonara taking us through kidney and bladder stones, and he spoke about having a holistic lifestyle. Holistic is a new word for some of us. It's a new word that has been making its rounds, and people have been talking about a holistic way of living, a holistic way of doing things. And it's not just about a good diet and having a wholesome diet, but it's about your lifestyle in general. And it's not just about the food that you eat, it's not just about the things that you drink, but also your mindset, what you do and what you feed your mind and your body. It's that energy. Habiba Mohammed says, Assalamu alaikum. My son has a hernia and is in constant pain. He was scheduled for an op, but due to COVID was declined. What is the best meds to take for the pain? Jazakallah. Habiba, unfortunately, we don't have Dr. Salim Choonara on the line anymore, but we will forward your question to him and get an answer for you as soon as possible. Do keep a lookout on our Facebook page, and the answer will be posted there. Shukran for your question. It is 11:32. You are listening to the Mario Mukonda Show on Salam Media, and we will be right back.